Well, parents of young children who are not eligible for the COVID-19 vaccine might worry about what may happen if their toddler tests positive for the virus.
As 10 TV's Kevin Landers explains, one local doctor says healthy kids have little to worry about.
Unlike other children's hospitals across the state, Nationwide Children's Hospital is not seeing a huge number of children admitted solely because of COVID-19. But that doesn't mean it's not an issue.
Today we have 55, which is perhaps the highest number we've had in the entire pandemic. But it isn't. It's really important to distinguish this is not impacting us operationally.
Inside Nationwide Children's Hospital, Dr. Reston Morse says most of the kids who tested positive for COVID-19 were admitted with underlying health issues who also happened to test positive for COVID.
A small minority of those who are admitted are critically ill. And many of those have other underlying comorbid conditions, including things like obesity. So it is fairly uncommon to see a critically ill child who is generally perfectly healthy in the hospital with a significant illness related to COVID-19.
Dr. Morse says 95% of the kids who are in the hospital with COVID are unvaccinated, and 25% of those are too young to get the vaccine. He says parents with young, generally healthy kids don't get severely sick from COVID.
A vast majority of children, especially young children, do perfectly fine. And with this current version, Omicron, it's a relatively mild illness for a vast majority.
Dr. Beth Liston recently spent a week caring for children with COVID at Nationwide Children's. She's also a state representative for District 21, which serves Dublin. She says the parents she spoke to whose children were eligible for the vaccine and chose not to now regret it.
There have been people that are not listening to experts that have decided that, they have a feeling or a belief system that is stronger than what science and what experts are telling us.
She says patients she witnessed in respiratory distress may have other issues down the road once they recover. It's called MIS-C, or multi-inflammatory syndrome in children, which is a rare disease.
And we really worry about that long-term impact on heart function and the coronary arteries. And so kids that develop that complication will have cardiology follow-up to make sure that the heart impacts have resolved.
Dr. Morse says there may be hope that we may be on the downslope of this virus. He says fewer of his staff are getting sick, and the hospital is not overwhelmed with COVID-19 patients. Kevin Landers, 10 TV News.